Hi, I'm Ishaan Khanna, CEO of LifeCell International, based out of New Delhi. Newborn screening is one of the most important public health programs across the world. Started off in the early 1960s and 70s, with phenylketonuria being the first disorder covered as a part of the newborn screening program by a scientist called Guthrie, and therefore all the newborn testing cards today are referred by his name as the Guthrie cards. This program has evolved over the years, and today countries like the US, the entire Europe, Australia, China have every baby born in the country tested for a certain number of disorders as a part of the public newborn screening program. When we look at India in comparison to that, with 26 million births that we contribute to the world every year, we have less than 1% of the children covered under a public or a private newborn screening program in the country, as against over 99% coverage across the world. In India, I think the biggest limitation that we see with respect to newborn screening is that it's not universal, and it's not made mandatory or made universal by any public health program like how it is across the world, where respective governments, public insurances take care of this program and ensure that every baby born in the country is covered under the program. So I think the biggest limitation that we face today is that while we contribute to the highest number of births in the world, we have a very poor or almost negligible newborn screening coverage. Some states have done some effort in doing pilot programs such as Goa, Chandigarh, Kerala. Now recently Tamil Nadu has started a program, but the effort is in very small pockets. And even in the private healthcare, if you look at, there is a very limited uptake across various hospitals in ensuring that every children or every child born in the hospital is covered under this program. So LifeCell, as a company, started off as a stem cell banking company in the year 2004. Was involved in private stem cell banking up till 2012, when we diversified our portfolio and introduced the diagnostics division in late 2011, early 2012. And that's when we launched first the newborn screening program under the brand name called Baby Shield. And what we've been doing over the years is evolving this program to suit the needs of the country. The biggest challenge that we faced when we started off with the newborn screening program was the lack of awareness. We found that many pediatricians and gynecologists were not even aware of what newborn screening is, what are the conditions or the disorders which a child is tested for under this program, and what to do if a child is found positive on any of these disorders in the newborn screening program. So one of the first things that we did was to get involved with the Indian Academy of Pediatricians, the National Neonatology Forum of India, and do awareness programs across the country to at least create a certain level of knowledge and awareness amongst the pediatricians and the gynecologists on the importance of newborn screening. And coming to the technology side, we also saw that in a country like ours, there is because newborn screening itself was a very new concept, there are very limited resources which were available to do subsequent testing on children who were found to be screened positive. So we came up with a two-tier newborn screening program where we said that every child who will be screened and will be found to be screened positive, we will take care of the next level of testing. And now what we have done as of last month, when we launched what we call as the Right Start newborn screening program, is that we have even combined the power of genetics with newborn screening, where we say that every child who will be screened positive will undergo a genetic testing to confirm the diagnosis. So we basically are going to take care of screening up till confirmatory diagnosis for every disorder which will be covered under the newborn screening program. So as I mentioned that LifeCell as a newborn screening entity, we have ensured that we don't only do screening, because the problem in a country like ours is that you do not have facilities available to do subsequent testing for children who are found to be screened positive. So we've integrated that in a single program, which we now call as the Right Start newborn screening program, which no other company, as of our knowledge in India, is doing today. We do screening if the sample comes positive or the child is found to be screened positive. We do the diagnostic testing on a genetic test to ensure that we give a confirmatory diagnosis, and even if it's a false positive, we inform the doctor that the child is free from any disease. Because one of the inherent limitations of any screening program is that it will throw up some false positive results, and you need to ensure that you give the right diagnosis to the child. So as a program, the biggest differentiator and I think the biggest value addition that a test like this can offer to a country like India is to ensure that the entire testing procedure is covered under a single program. So LifeCell, as I mentioned, started off as a company involved in stem cell banking early in 2004. Over the years, we've evolved into an organization that's involved in mother and child healthcare. And when I say that, we basically have now divided the company into three groups, and the products or the services that we offer into three groups. So we call it LifeCell Biobank, which is involved in stem cell banking and other tissue banking. The second is LifeCell Diagnostics, where, as I said, we started off with newborn screening in 2012, and in 2015-16 we entered into the space of prenatal screening, where we do all the tests that are involved in the pregnancy stage, right from screening to cytogenetics and now molecular diagnostics. We were the first company to launch a test called as the QF-PCR, which is used in prenatal diagnostics in India. We were the first commercial lab to do that in the country. And now we are evolving more into the space of molecular diagnostics and molecular genetics when it comes to our diagnostics space. We hope that in the months and the years to come, we will further diversify that portfolio and move out of just being a mother and child diagnostics company to even including specialties such as oncology, immunology, etc. The third division, and that's something we have very recently started, is called LifeCell Biologics, where we are going to be launching products in the space of wound healing. So as a company, we want to grow further as an entity in the mother and child healthcare space. So even when we look at the concept of stem cell banking, we have changed the paradigm of how it is viewed from being just a private stem cell bank to a community stem cell bank, where we ensure that all the members of the community get access to stem cells, which is the entire basis of why anybody would want to get stem cell banking done. So to improve access, to improve availability, we've moved into community banking, something that we launched in the March last year, and we'll be opening that community out in March 2019.